another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have another awesome spotlight session with Amanda Newell from the Bradley University Future Education Model Dietetic Internship Master of Science program based in Peoria, Illinois. All right, welcome to the podcast, Amanda. To get us started for this episode, I would love for you to give us an introduction to you, your journey to RD, and how you landed in your position with Bradley University.
Sure. So thanks for having me, Erin. I'm excited to be here. So I'm Amanda Newell, and I am the program director here at Bradley University. And my educational journey actually started with me thinking I wanted to go into medicine. So when I was enrolling in my first semester in college, I had to take a gen ed course, as we all do, and there was one that was nutrition that met the requirements. So I signed up for it, I took it, and I just became so fascinated with it. I remember talking to my professor and kind of learning about what you could do in the profession. And I admittedly was one of those individuals who had never heard of a dietitian before until that class. But I really just loved, especially the preventative side of nutrition. And so obviously, ultimately, I changed my major and have never looked back since. And then while in undergrad, I was involved with some honors projects, and I worked for a microbiology professor, and I became really interested in research. And so from my undergraduate program, I took a little bit of a different path. I feel like that's becoming a little bit more typical now, where I went straight into a graduate program, into a master's program where I studied the chemopreventative aspects of an herbal tea, which was really cool. And then during that time, I still was thinking about being a dietitian. I wasn't exactly sure if I wanted to. And ultimately, I did decide that I wanted to pursue the RD. And so right upon graduation, I started pretty quickly a dietetic internship, a one-year dietetic internship, finished that. And then I stayed on at that hospital as a clinical dietitian. And so I had that unique experience where I was an intern on 1 week, and then the next week I was functioning kind of as a preceptor with supervision, of course. And then while I was a clinical dietitian, I applied to be an adjunct professor at Bradley University. But while I was in the midst of applying for that job, they ended up having a temporary assistant professor because another individual was on sabbatical. And so while they were on sabbatical, they needed someone to teach classes and do some of the things that they were doing. Of course, they had big shoes to fill. So I did that for a year. And then during that year, Bradley decided they wanted to start a dietetic internship. So I was hired as the founding director. So I did that I've done that ever since. But then in the meantime, doing that, I worked on my PhD and finished that just a few years ago as well. So I've been at Bradley for quite some time, and I am really excited to get to talk to you about our program today. So I believe with that, I will get started talking about our program. So as I said, I am super excited to be here today. I love food puns. I'm sure many of you do as well. And Bradley University, if you're not familiar with us, we are a private university, and we've got about 5,500 students. That includes both graduate students and undergraduate students. We are founded, our namesake, Bradley, is from Lydia Moss Bradley. We are very proud of her and kind of the way that our university was established. And so every year we actually take our picture. This is a real life-sized statue of Lydia Moss Bradley there in the middle, you can see. So we like to take a picture of her. Obviously, we haven't yet this year because of COVID, but we like to have our students take and kind of recognize where we come from and where our roots are, because it is really important to us. We are located in Peoria, Illinois, which if you're not familiar with, we're kind of midway between St. Louis and Chicago. I've got us as a little star there, and you can see our skyline. We've got a river, which is really nice, especially in the summer. And we are housed in the Family and Consumer Sciences Department. Now, a little bit of kind of a working timeline for our program. When I started at Bradley, we started that graduate certificate program. So that was a one-year program where students would take some graduate classes, not a full master's program, and then do the traditional types of dietetic internship things. So that was from 2010 to 2017. We knew that a master's was going to be required, and so our program then shifted to an MSDI. So that started in 2016, and that's the program that we currently have is an MSDI. So that's the very traditional, they take graduate classes, basically the first year. And then the second year is more of the supervised practice experiences, a little bit more separate, than what the next one is that future graduate program. And so we are now transitioning to the future graduate program. So we've got the current program, the MSDI right now. We do have students enrolled in it. But moving forward, we are looking at transitioning to the future graduate program starting this coming fall. So our faculty have been working really hard to develop this new program. And we did receive approval from Ascend. So Ascend is the accrediting body for dietetic programs in December of 2020. And our administration has been involved in every step of the way throughout this entire process. And so for those of you who are familiar with academia, things sometimes move a little bit slowly. And so we're still waiting on some of those I keep saying like the final approval of things, so we can update our website. So I'll talk a little bit about that in a second, but we are moving forward with this program, the Future Graduate Program, in the fall of 2021. But if you've looked at our website, you'll see that there's still a lot of information from the MSDI, and it's just because we're waiting for all of those processes to take place to be able to update that. So that, we're kind of in this little limbo transitional stage right now, which I think is so perfect for 2020, 2021, because we've all been experiencing kind of that in the pandemic. So if it was going to happen, I feel like this was the year that it would happen. But just a couple of things to think about in terms of the future graduate program. So if you're not familiar with it, it's designed really to better integrate the didactic coursework with the supervised practice experiences, utilizing that competency-based curriculum. And so the goal obviously is to prepare nutrition and dietetic professionals for future practice. So rather than having the classes, which have experiences in them too, and then the supervised practice separate, we're really embedding the two. And so integrating them and having those experiences in the classroom. So students are going to have those experiences really from day one. So a couple of things to think about as I talk about that future graduate program. One is we are going to accept students from a variety of backgrounds. And that's one of the things that makes these programs a little bit more unique, is with our current program, we can only accept students who have a DPD verification statement. We will continue to be able to accept students who have a DPD verification statement, but we will also be able to accept students from a variety of backgrounds. They do have to have a bachelor's degree, which is typical. And then we do have a few prerequisites. So like anatomy and physiology, advanced metabolism, a ServSafe certification, and like medical terminology or being able to pass an exam. If anyone is interested in whether or not you've got those prereqs, just let me know. You can send me an unofficial transcript. I work with our graduate school. We've got a committee within our department looking at these applications too, and we can get a feel for whether or not those experiences might meet. Because we want students coming in to have a very clear idea as to what prereqs you might have to take before coming to Bradley, and or what ones we would accept before coming in to not have to take them later on. So the second thing, in addition to not just accepting DPD students, is that we are currently accepting applications. Probably many of you are familiar with second round match, which is what's going on right now during this week, a second round match. And we will gladly take applications from students, now and until we fill our class. So we are excited and ready to be accepting your applications. A little bit about what that looks like. We would want to see a resume. We would want to see an essay with some specific questions on there. We need to see letters of recommendation, the typical 3 letters of recommendation, official transcripts, but you also can send unofficial to kind of make the process go a little bit quicker. And then you apply to our graduate school, where you have to provide like some demographic information and obviously pay a fee with that too. If you are interested in applying, I've got my information later on too, but I would encourage you to just send me an email and I will send you a very explicit list saying like step 1, step 2, these are the questions, to make it really easy for you. So it's those 4 pieces of information as well as applying to the graduate school. And we are having students apply through our graduate school and then sending me the information so our committee can look at it a little bit quicker to have a pretty quick turnaround to be able to review those applications. So if you're considering applying in any way, feel free to reach out to me, to look at the prerequisites if that's something that you're interested in, or applying, and I will email you those very specific instructions on how to apply to make it as easy as possible for you. The third thing I wanted to mention are some of the courses that we have. So our future graduate program has typical courses you would expect to see in a dietetic program, M&T, food service management, research, counseling, community nutrition. And then we've got some flexibility with our electives. So students all take a core that they have to take those classes. And then they've got a little bit of flexibility in what they might be interested in for some other graduate courses. So you get a little bit of say-so in some of those classes that you're taking, which is really neat. The core courses, though, all have experiential learning embedded into them. And so we do that for some of our classes right now. So we feel like we're in a pretty good fit to be able to transition to this future graduate model. But all of our core courses are going to have experiential learning embedded into them. And quite frankly, experiential learning isn't new for us. It's really at the core of what we do at Bradley. I love it so much. It was part of my dissertation. It was my theoretical framework for my dissertation. And we really, Bradley in and of itself in our department, we really want students to get that hands-on real life experience. It's good to read about it in a book, but we want you to actually be able to experience it too. So that's kind of one of the things that sets a traditional MSDI apart from the graduate or the future graduate model, in that we are really doing that from day one for students. In addition to the coursework, obviously, you're still going to be completing kind of the traditional types of experiences like a supervised experiential learning, or the rotations, I think is kind of what most people are familiar with. So all of our students will be required to complete rotations in clinical, food service, and community, which is very typical for most dietetic programs. Clinical, we've got a wide variety of experiences for students to be able to work in: large hospitals, small hospitals, outpatient clinics, just to name a few. I'm obviously not going to be able to name all of them in this time. Food service, our students are working with university food service, school food service like K through 12, hospital food service as well. And they also can get experience with like a big corporation, like I said, EXO or Aramark, or a smaller one that might be, like hospital, like within the hospital. So they get a pretty differentiating experiences within there, which is really cool. Community is pretty broad, and we've got grocery store, dietitians, extension office, corporate, working in corporate offices, urban gardening, kind of a community clinic types of settings. So a good variety of experiences in there for all three of those rotations. And so students will be able to, in the first semester, kind of figure out a little bit what they're interested in, what's a good fit, and be able to customize it. So I think that's something that's really exciting for us moving to this future graduate program, is really working with our students to try to find a good fit for them to be able to complete those experiences. So they're going to be able to customize it to try to then position themselves better later on. And I'll talk a little bit more about that later too. And then just a couple other things to note about what we're looking at for this future graduate program. And these are things we've done for all three of our programs, is we really value interprofessional experiences too. So our students work with each other. You're going to take some classes just with other dietetic students. You'll take classes with other disciplines, and then you'll have experiences with other disciplines to try to really expand your horizon and learn how to work effectively in a team. And then we've got some field trips too. So some tours of like a farm, advocacy day. We do an interprofessional simulation with lots of healthcare students throughout the country. So we really try to embed all of that in the classes, and then have them be able to do those culminating experiences kind of moving through that program. So I just wanted to show some pictures. I think sometimes visuals are a little bit easier than just hearing me talk about them. So as you're looking through here, you'll see that we are in the traditional clinical types of settings, doing nutrition focused physical exams or seeing patients using food models. We've got food service examples on here. We've got community ones, some kind of in that didactic coursework. And so it really just, I think, displays the variety of experiences that can be obtained in our program. Obviously, we haven't had students in the future graduate program yet, because that's coming. So these are in our current program, but there's going to be a lot of similarities in terms of those experiences. And so some of them you'll see they're group projects. So you might see a couple of interns or a group of interns that they work on things together. That will remain the same. And some they get, that one-on-one contact, particularly when they're working with their preceptors to try to really maximize that learning opportunity for them. So why choose Bradley? We are a small school, and so you develop really close relationships with both faculty and your preceptors. We know our students really well, and they know us as well. And so I think that really does set us apart, that we, they're not just another person to us, they're truly part of our program, part of our family too. I've mentioned the experiential learning, but the fact, and I think the pictures illustrated that you've got a variety of settings, and this does start in your first semester. So you're not going to be waiting until year 2 to kind of get immersed in those experiences. We're going to be jumping in on day 1. So also there'll be an opportunity to attend professional conferences. So we have students who have presented research. I've got 2 who are presenting a research project this weekend, actually, for an interdisciplinary project they did with some physical therapy students. We've had students go to FENCI before, we've had them go to Advocacy Day, and certainly there's other opportunities as well. Also, you've got access to our nutrition lab, we've got a counseling lab, a food lab, and a recreation center. So you'll have experience with your classes in many of those, and then a recreation center, kind of typical for a university setting. You also have those additional experiences in areas of your choice. So that's what I was alluding to earlier, where for some of those rotations, you will be able to help customize those. And so if this is a population that you really want to experience with, or this is a geographical region that you're interested in, we will find a way to help you get experience to be able to really expand your interests and then network, right? That's another goal that we have, is to try to network. And we have found often that some of those opportunities where the student really is able to customize that part of the supervised experiential learning, that then it leads to a job. And so, that way they are in an area of their choice. We also have a study abroad opportunity. And so this is something that students can elect to do. So it is an additional cost if they elect to take this class. But it does include airfare and hotel and all of those types of things. But it is a class that is taught in London, and it is through Bradley. So students would go to Bradley with a Bradley faculty, and they would be there for a couple of weeks. It's usually over winter break, and they would be able to take a class while being immersed into whatever the culture would be. And so we have been going to London. It will be that way for the foreseeable future, pending pandemic, of course. And so they really get to, see a different side of the healthcare system, looking at food, and really being able to take that study abroad experience. And that has been a highlight for students who have been able to go. That has been a really great experience for them. And so much more I would love to share with you. So if you have any questions, absolutely reach out to me. So for more information, please visit our website. But as I mentioned earlier, it's limited right now for the future graduate program information. There's 2 ways you can get to our website. The first I have there is just bradley.edu. That takes you to our regular homepage, and you can go to the A to Z and just search for like the D for dietetic, and you'll see our program, you'll see the program up there. If you copy paste this website here, you can do that. It takes you to the same one, but I think sometimes the A to Z is a little bit easier to remember. You will see on there that it mentions about the graduate program, the new one, and that we are accepting applications, and then just to reach out to me. So if you're interested or want some more information, feel free to let me know. I'm more than happy to do a Zoom call with you to answer some questions. I find that more effective than having a student ask a question via email and then have to respond and go back and forth, just because we are in this transition period. So feel free to let me know and we can set that up, or a phone call, whatever works best for you. You can follow us on Facebook, and please contact me for questions, and I would be more than happy to put you in contact with some of our current students and some of our past students as well, because I think it's nice to hear a student perspective in terms of kind of a day in the life of and those types of things. Again, we are currently accepting applications. So second round is happening. If you didn't participate in first round, we are accepting them now anyway. If you did and you are waiting for that second round process, we will be ready. So if you are interested in our program, please just give me an or email me, and I would be more than happy to share those specific directions, talking about exactly what we need, how you would apply, and then a Zoom call or a phone call if that would be helpful to kind of talk through maybe some questions that you might have about our program. We are going to be reviewing these as quickly as possible. And so we're not going to wait for several weeks to see how many we get. We're really wanting to look at those applications and get moving so we can fill our class as fast as we can. So I appreciate your time, and I understand there might be some questions here.
All right. Perfect. Thank you for that quick overview. That was perfect. So I'm going to jump into the 5 questions that I ask all the programs that come on the podcast. And these were put together with the help of my students to make sure that I was asking the questions that they really wanted to know the answers. So the first one is, what is one thing in particular that you just really love to see when you're reading an applicant's personal statement?
We understand that not all students know what they want to do with their degree. We don't expect that you have just, laser vision and this is exactly what you want to do. Part of the beauty of dietetics, I would argue, is that there is so much we can do with our within our profession. But what we do want to see in that letter is something about you. We want to get to know you as a student a little bit better. It's your chance to tell us why you enjoy certain aspects of the profession, or why you might have struggled with something, and then what you learned from it. And honestly, some of our best letters give us a new understanding and appreciation of our applicant's journey.
All right. When it comes to resumes, true or false, an applicant's resume should be 1 page and 1 page only. Either way, why?
So false, it needs to include all of that relevant information, which is more important than the length. But you do want to be mindful of that. So if you've got 1 sentence on the second page, it's probably worth the effort to condense it to 1 page. But on the other hand, if you have a ton of experience, we want to see that. We want to see all of your experience. So I would encourage you, as you review your resume, look to see if it's consistent, if it's formatted well and concise, and focus less on the length for our program specifically.
All right. So what is one or maybe more things that an applicant may do, and this could be in communication with you before applying or in the application itself, that may raise some red flags for you where you would think maybe this person isn't the best fit for this type of program?
Obviously, there's, red flags that I think we're all pretty aware of, but fortunately, I find that students really do try to put their best foot forward. And one of our preceptors actually tells our interns that their time with her is like an 8-week job interview. And I really do think that's good advice. We know that in those 8 weeks, you're gonna mess up, and that's okay, because none of us are perfect. But I don't think we have something, that would guarantee that a student wouldn't be considered, aside from those red flags that we all are really thinking of. What I can say though, is we do want to see that a student wants to come to our program. So if they just aren't that into us, that would probably be cause for concern for us. If we get a feel that they're not really into what Bradley is and what our program is, that certainly would be a red flag for us.
All right, my next question, with the program transitioning into a new format, what are some maybe changes that you've made that make the program really unique compared to other future graduate programs that are coming out?
Yeah, we've been a program for a long time, and we're always working to improve it. Since the inception, we have constantly changed things. I don't think I've had 1 year where it's exactly the same year to year, just because we are, we're having the interns complete course evaluations of every supervised practice experience and preceptors. They check in with me all the time. They do exit surveys and alumni surveys. And so we really value that feedback and make changes very regularly. So, right now we are working on that future education model. And I think what sets us apart is that we've really worked to tie this program into our departmental mission, which focuses on social equity and sustainability. And I mentioned earlier, we're a family and consumer sciences department. And so by nature, this is interdisciplinary, and it provides a holistic view of an individual, family, and community health. And kind of tying in with the community, the Peoria area is amazing. We have so many opportunities. It's not a big city necessarily, it's a good sized city, but it's not a major metropolitan area. But there are so many different opportunities for our students, and our preceptors are so excited to be able to work with us. And we've got a really great relationship with them. And so we are adding new sites constantly, and really trying to provide a really great experience for students. A couple of things I kind of alluded to in that PowerPoint part, but the fact that we allow our students to be able to customize part of their supervised practice experience, I think is really unique, and we're continuing to do that because we see the value in it. It does allow students to dive deeper into an area that they're interested of dietetics, whether it's sports nutrition or clinical nutrition, whatever that would be, also into a geographical area. So Peoria is great. I'm biased, I live here, right? But maybe they're wanting to explore somewhere else, once they graduate. And so it kind of allows them just to tiptoe a little bit into another area. And quite frankly, this often leads to positions for them. And my goal for our graduates and our interns isn't for them just to get a job, right? It's for them to get their dream job. So it makes me really happy when I get a phone call or a text from an intern where they have found their dream career path. And a lot of times it's aligned with that experience that they were able to have, because they kind of found their niche and then they started to network, and it kind of, dominoes from there in a good way. The other unique thing I would say is that study abroad experience. That's always a highlight. We find students don't always get the opportunity to study abroad in their undergraduate experiences. And so we've been able to offer that every year we've had our program, except this past year because of that pandemic. And so we really are excited for students to be able to have that opportunity to kind of see dietetics through a different lens, which is really important because we definitely are a global world. And I think the pandemic has illustrated that to all of us.
Right, perfect. Well, my last question of the 5 is a 2-part question. And the first part is, what are the 3 best adjectives, descriptors, or phrases that you feel best described the new program overall?
Yeah, I would say student-centered. We really do have the student-centered at everything that we do. We want to provide a quality program, a rigorous program for them, but allowing them to have a little bit of say-so, like in those rotations that I was talking about. So really sitting down with them and being able to personalize, find out what they're interested in, and then being able to network and make some of those experiences happen. So I think student-centered certainly is something that we value. And kind of represents our program and our philosophy. Also interdisciplinary. All of us value working with other professions and making sure that our students are able not just to work with other dietitians, which is important, but to be able to work with other professionals as well. And I think that kind of roots at the patient-centered approach, right? That we really want that patient at the center of the care that they're getting, whatever that patient looks like. And so making sure that they really do embrace that interdisciplinary approach. And lastly, I would say experiential. So like I mentioned before, that's really at the root of who we are, and providing experiences to our students to be able to really get in and kind of hands-on experience to be able to apply what they're learning and not just kind of learning about it from a book.
All right. So the second half of the question, very similar to the first, the 3 best adjectives, descriptors, or phrases to describe your ideal applicant.
Sure. So one I would say is important for most students who are both graduate students and completing the supervised experiential learning is they've got to be a juggler, right? They got to know how to be able to juggle the demands of, working with the preceptor and their classwork. And so being able to not just focus on one thing and kind of push everything else to the side, they have to be able to juggle all of those different responsibilities. Second, I would say being curious or willing to find answers. And so a lot of our experiences that they have both in the classroom and out are reflective. We pose questions to them and we really want them to think about it and then want to know more. So we want them to want to learn about things and to read about things on their own and really kind of find their way in dietetics. And the third would be enthusiastic and positive. We're looking for someone who is just excited about the profession and, really wanting to make the most out of every experience that they're getting.
All right. Well, I just have one last question about RD exam review. So how have you been integrating that into your program, and how do you continue to, or how will you continue to do that into the new program?
Yeah, so for RD exam review in the courses that we have them take like mock exams. So like I'm teaching an M&T class with them right now, and their final exam is based upon the RD exam. So it's using the content that we talked in class, but just to kind of get into that mindset of more than one question can be right. Which one's more right, and why is it more right? So it's just getting them into that mindset, with content that they're familiar with and should be comfortable with. We also have review guides for them to be able to kind of look through to determine, what's going to be the best method for them. We've got some programs that we pay for and have in our lab for their access to be able to utilize kind of at their leisure, flashcards and those types of things. And then we have a university near us offers a study session for our students. And so a couple of other programs kind of get together to be able to have a RD workshop study session, kind of a few weeks, I guess, leading up to graduation for them. Pandemic obviously changed that a little bit last year, but in the past, we've been able to offer that as well.
All right, perfect. Well, that was all the questions that I had for you. So to close out this episode, I would love for you to give our viewers a quick take-home message for potential applicants this year.
Yeah, so as we're transitioning to this new future graduate model, feel comfortable that we have been a program, we've been accredited for a long time. And so we feel like we are in a really good position to move to this new model, because a lot of the elements of competency-based education we've already been doing. And so as you're thinking about our program, I really just encourage you to reach out to me so you can meet with me and we can talk about all of those experiences and the prereqs and the application. And we would love to get to know you, and we would love to be able for you to get to know our program. So absolutely email me, and I hope that I can talk to you soon.
All right. Thank you so much, Amanda, for being with me on this episode. And for those at home who would like some more information on the new program at Bradley University, I provided their program web link in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another awesome dietetic internship. And we'll see you next time. That's it. Yay.
Thank you.